So I want to use this opportunity to cover a little bit on the nutrition aspects of joint health and osteoporosis. Just to give you a quick idea, I've been with Emerald Physicians this is my 16th year, and for the past 15 years, I have worked with patients using plant-based nutrition to see a lot of their chronic diseases either prevented, or if they already have the disease, kept under control. And in some cases, I was able to reverse diabetes and cholesterol issues. And so there is a lot of opportunity that we have that is on the table, on the dinner table, to see how we can control these diseases. And when we look at a lot of these diseases, whether it is cancer, whether it is diabetes, heart attack, dementia, or arthritis, they all have common thread. Two phenomenons that happen. One is inflammation, which is common for many of these chronic diseases, and the other one is what in technical lingo it's called oxidative stress. You might have heard of antioxidants, which is a kind of a very common term now. So oxidative stress or oxidative damage is another common thread. So these two issues, inflammation and oxidative stress, pretty much kind of is the root cause of all of these chronic diseases that we see. So in other words, what you will learn today to address inflammation in joint health through food or food choices is going to be the same strategies that will help you to not get dementia. It's going to be the same strategies that is going to help you to not get heart attacks. It is going to be the same strategies to not get diabetes, right? Now, if you're somebody, some of you have attended, or many of you have attended previous sessions we did, we know that dementia is in scientific circles, now dementia is called type 3 diabetes, right? So dementia, Alzheimer's disease is now called type 3 diabetes because we know that the same problems that happens in diabetes is the same issues that are noticed in the brains of dementia patients. So everything we're going to talk about today is a one-stop shop for you to not get into those chronic diseases, right? Let me see. So this is just to give you a background of the Barnstable County data. So nearly more than 1 in 3 individuals in Barnstable County has arthritis. And the point here is to say how unhealthy nutrition leads to these 3 changes: degeneration, aging, and weight gain, and all of these can lead to arthritis. And this is going into a little bit of details about arthritis, but what you would notice here is that all the mechanisms of how arthritis happens, whether it is a local issue, whether it is a local issue right near the joint, where obesity can be a factor affecting it, or whether it is aging changes related to joint function due to increased fat mass or reduced activity, or whether it is systemic, like overall body situations like obesity, nutrition, the type of job they're doing can be a factor, or other aging changes. And I'll focus a little bit on this issue called AGE, AGE. Does anybody know what AGE stands for? If you attended some of my lectures, Advanced Glycated End Products. So that is the AGE there. And can anybody guess and tell me what happens to your body if you have more of these aged products in your blood? The answer is right there. You're going to age faster. So when the advanced glycated end products accumulate more in the body, it's been shown that we age faster. That means the degenerative processes, including joint diseases, arthritis, any other degenerative issues, including dementia, they can proceed faster, they can happen faster if the body builds up more of these advanced glycated end products, and we get the advanced glycated end products inside our body through the food that we eat, especially the food that is burnt, charred, blackened, and deep fried. So those are the foods that basically brings in more of these advanced glycated end products. And it is a classic sign of aging and degeneration. One example of these advanced glycated end products is something that many of you are familiar with, that we measure in the blood test. It's called hemoglobin A1C. It's done for diabetic patients. And so that is basically a prototype of these advanced glycated end products. Hemoglobin A1C is a glycosylated or glycated hemoglobin. That's what that is. And so it is a classic example of these advanced glycated end products. So when diabetes gets worse, the A1C is higher, right, in the blood test when they measure. So when the A1C is higher, that means that person is actually aging faster. So if diabetes is not under control, it's a sign that the degenerative processes of the body is aging faster, which also tells that that person has a higher risk for dementia as well. So all of this kind of comes to full circle when we talk about inflammation and oxidative stress. So inflammation simply is a reaction that the body puts out in response to any kind of insult. Somebody has a viral infection in the lungs, they get bronchitis, right? So that's an inflammation, right? If somebody has a joint issue, inflammation, it's arthritis. So any kind of insult that the body gets and it responds to it with a certain set of reactions, and that's called inflammation. So the insult can be a viral infection in the lungs. It can be a repetitive sports injury that's leading to a premature arthritis. Or the insult can be the food choices that we make. So we can insult our body during breakfast, lunch, and dinner time. And if we do it consistently by making poor choices in the food choices that we make, then we are consistently leading the body towards inflammation because there is repetitive insults happening because we made the wrong choices. So let's talk a little bit more about the things that really brings the inflammation to the body. So I'm going to talk. We already talked about the advanced glycated end products. We covered that. The other piece I want to talk about is something called abdominal obesity. So abdominal obesity is a collection of a special type of fat deep inside the abdomen called visceral fat. It's also called abdominal fat sometimes. So that happens when we are eating excess calories and not burning enough calories. So when we have more calories coming in and we're not burning enough of the calories, the excess calories is built up deep inside the abdomen and called as visceral fat. It's also called abdominal fat. And the visceral fat produces inflammatory molecules. It makes inflammation happen. It's like an inflammation factory that's happening there. So anytime we exercise to burn calories, and anytime we pay attention to the calories that we eat, choosing low-calorie foods, choosing foods that are high in nutrients, we are basically kind of bringing that factory down to a standstill. That's what we're doing. So we need to look at strategies of how we can make sure that we can shrink the internal fat, the deep abdominal fat, through the food choices that we make. So an example can be if we choose a high-calorie, low-nutrient food, which can be fatty foods, oil, meats that are high in calorie, or sugar, high in calorie, low nutrients, then that leads to an increased buildup of the internal fat, the visceral fat. Does that make sense to everybody so far? Yeah. The other piece that I want to talk about here is oxidative stress. So oxidative stress, simply explained, is like a bull in a china shop inside the body, right? So the body is made up of different organs, different tissues. Each organ and tissue is made up of zillions of cells, and each tiny cell is like a little factory, right? Every day there is processes that happens like in a factory. There is sewage that comes out of the cells as part of the process, and the sewage can build up to a certain degree, but the body has a capacity to eliminate the sewage, like in any factory. When the wear and tear is too much that's happening inside the cell, there's more of these sewage stuff that's built up. So body tries to fix that, clean it up, and that leads to buildup of these what I call as rogue molecules called free radicals or oxidants. It's another name for it. But basically what they do is they are toxic substances that build up in the cell, and they damage the nucleus of the cell. They damage the fragile, important elements of the cells and the tissues. So when we have more of these oxidants, we end up with more problems, including joint issues and other issues like cancer. When we have antioxidants in our foods, they work against these rogue molecules. They are, as the name implies, they are antioxidants. So the antioxidants are rich in colorful fruits and colorful vegetables. So the more we include them on the plate, the better it is to reduce oxidative stress. And so that's why the strategies that I talk about today is going to help with preventing or postponing degeneration in the joints. But the same strategies also helps to prevent cancer, prevent diabetes, heart attacks, and dementia, and all the chronic diseases that we talk about. This space is something called endotoxins. The endotoxins have been found to be higher in certain diets, especially the diets that are rich in saturated fats. So I do recommend decreasing saturated fats, whether it is coming from an animal product or even if it is a plant product, whether it's high-fat coconut oil. I recommend against using many of that. So anything that has a lot of saturated fat can bring in something called endotoxins, which leads to increased joint damage. The last thing I want to talk about here is something called arachidonic acid. I don't know if you can see that there. The arachidonic acid is a particular kind of a raw material which breaks down in the body to create more inflammation, create more cancer. And with regard to, can anybody name an anti-inflammatory that you can buy in CVS or Rite Aid? Anti-inflammatory medication? Right? Motrin, Aleve, Advil. So they all work through a particular mechanism. The way your Aleve and Advil and Motrin, they work through by stopping this arachidonic acid. So the arachidonic acid breaks down into byproducts that lead to inflammation. And scientists and researchers and pharmaceutical research figured out the steps that arachidonic acid has to go through before it creates those inflammatory molecules. So they found out these catalyst enzymes that propagates this sequence of events, and this Aleve and Advil and ibuprofen that you buy in the store stops that event from happening. So that's how they work. So we do know that inflammation is produced by arachidonic acid, and then we do know that these are the top 3 ranked foods in the standard American diet that leads to the highest intake of arachidonic acid in the standard American diet. Ranked number 1 is chicken, number 2 is eggs, and number 2 is beef. I don't know if you can see the ranking there. So this ranking is based on the National Cancer Institute, which looks at cancer risk factors for inflammation. They measure the national per capita intake of foods that are high in inflammatory markers, inflammation producing substances like arachidonic acid. If you go home and you're getting this printout, so you can Google this using the same keywords to search and find out the entire ranking list. There is a list of 12 in that. I just picked up the top 3 there. So I want to just go back to the previous slide if I can figure out how to do that. Let me see. So yeah, so just to touch base again on how aging and damage to joint cartilage happens. We want to make sure that we don't eat foods that are going to increase the advanced glycated end products into the body. So we want to make sure that we are minimizing or eliminating burnt, charred foods. That's number 1, because they increase age. And number 2 is you want to see how we can make sure that the caloric intake, we choose foods that are low in calories but high in nutrients, like the green leafy vegetables, the colorful fruits. Vegetables and fruits rank higher in the sense that they are high in nutrients but low in calories. So you want to choose more of that. And then you want to, again, the same way it works by increasing antioxidants in your food, so it's going to reduce the oxidative damage. And the other aspect is to reduce saturated fats and foods that are high in arachidonic acid in food. So while I am talking about the oxidative stress, I just want to touch upon a little bit on osteoporosis. I know Dr. Hool mentioned about osteoporosis, and I haven't prepared any slides on that, but I do want to touch upon, while we talk about the oxidative stress, that we used to, in postmenopausal women, we know that they are at a high risk for osteoporosis as the menopause hits. And the past decade has given a good understanding of why that is so, why menopausal women have a higher risk for osteoporosis, weak bones, is that now we know that the damage that happens in the bones is not because of calcium loss and not because of a deficiency of those nutrients that we thought of, like calcium. We now know that the damage that happens in osteoporosis bones is due to oxidative stress. Oxidative stress is the fundamental mechanism why osteoporosis happens in back bones. And in women, as long as they have their estrogen hormones until they hit the menopause, as long as they have the hormones, the estrogen is an antioxidant. So as long as that they have that antioxidant source with the estrogen hormone acting as an antioxidant, their bones are protected. But once they hit the menopause, the estrogen levels go down. They're not getting the natural protection of antioxidants, and they're not eating enough antioxidants that is rich in a plate that is full of greens and vegetables and fruits. So the natural inbuilt source of antioxidants is not there. Food source is not there. So there is a rapid decline in the bone strength, and that leads to osteoporosis. That is the latest understanding of the fundamental mechanism behind osteoporosis. So it's important to remember that. The other big piece for osteoporosis is the physical activity, how much load is on the bone. So we do know that people, astronauts who go on the space, who have zero gravity, there is no weight for these bones. The bones are kind of weightless. So they have a higher risk for osteoporosis because there is no load on the bone. The bone needs to work hard. The bone needs to have a load to carry to prevent osteoporosis. So the other big piece to prevent osteoporosis is to make sure that some level of strength training is done for the major groups of muscles, for the upper limbs, for shoulder girdle, for the hips, and for the core. How Catherine talked about the core is so important to work to strengthen to challenge the back muscles and bones as well. So and jump roping is a very, very effective. If you can do it safely, jump roping is a safe way to maintain bone health. If you have grandkids, I tell all, if you have girls who start doing jump roping when they are 8 and 10 years old, and then once they get like 18, 20, they stop doing jump roping, please make sure they continue to do it, because that is one of the best proven exercises to prevent osteoporosis in their adult life. And we know that by the time they hit 30, 90% of their future bone strength is set by that age. So there is only a little bit they can work on after the age of 30. So it's very important to do that. And after that, if you cannot do that safely, you got to make sure that some kind of a strength training is done for the major muscles of the body, the hips, the shoulders, and the core. And that's going to be very important to maintain bone strength. I think I think that's all I have, I think. I have a case study of a patient of mine. How are we doing with time there? Okay. So this is just a patient of mine who we worked on her cholesterol. Joanne Irwin, she has given me permission to share her name and picture in my presentations. Basically, we tried to work on her dietary change because of the cholesterol level, which was, the LDL cholesterol was very high, 170. By changing her to a plant-based nutrition diet, she not only reduced her cholesterol, but her arthritis pain in her joints went away, and she became very functional. It's just to get an understanding of how, when we try to address one chronic disease, in this case cholesterol, her other chronic disease issue, which is the arthritis pain, completely got better. So she's very functional now, and it's just one example of that. I think I should be finishing with that, I think. I'm going to skip that. This slide, this is pretty much the tips that I wanted to leave with, saying, what are the top things that they can do to kind of avoid or mitigate the effect of arthritis is eating mostly plant-based meals. We're going to have Dianna, who can talk a little bit more about it very soon about that. Avoiding fried, burnt, or charred foods so that you can reduce the age, advanced glycated end products. Limiting or avoiding dairy products is important so that you can reduce the endotoxins that I talked about, endotoxins that comes from saturated foods. Maintaining joint mobility and muscle strength by staying active, and avoiding and minimizing sports injuries. That's one of the things I liked how Catherine said that people try to start and do everything in the next week, but then they injure themselves, and the injury sets up for a premature arthritis, and it's just something very important. One of the goals you want to set when you go on an exercise program is I'm not going to get injured. That's going to be part of the goal, right? So I'm going to ask you to hold off to questions, because I'll take questions after Dianna does the presentation. So I'm going to have our next presenter, Dianna Carpentieri. Dianna is a registered dietitian. She's a local food and fitness enthusiast. She's passionate about helping others achieve their health goals through nutritional counseling. And Cape Cod Healthcare has now partnered with the American Cancer Society. They have a funding from the American Cancer Society to create a nutrition program for cancer survivors. And Dianna is part of the nutrition program, teaching the cancer survivors in that program. And today, Dianna will share a few recipes that incorporates a lot of the things I talked about, anti-inflammatory principles in diet. And so without further ado, Dianna, stage is yours. Thank you. I don't know if you need that or not.
Can everyone hear me? Okay. Hi, everyone. How are you? Good. So I am just going to talk pretty briefly about some foods that are very high in antioxidants. So going off of what Dr. Sidhartha said about the importance of trying to eat plant-based nutrition. So does everyone know what that means? Yeah. Okay. And how many of us here do try and eat plant-based? Awesome. A lot of you. How many here are kind of like, I don't know about that, right? Yeah. So, so although for some of us it might be really hard to go completely plant-based, I wanted to provide you with some options of foods that, like I said, are very high in antioxidant properties. So those are our fruits and vegetables, specifically berries. So we're really lucky it's finally spring and we're coming into summer season, so berries will be in season. What about in the middle of January in Massachusetts when I eat a strawberry and it tastes like water? Probably not as appetizing. That's okay. Get frozen. No problem with that. One thing to keep in mind though is that we look on the back at our ingredients list, make sure it's just that fruit or that product. In this case, make sure it's just berries. Food companies, for some reason, like to take already naturally sweet foods and add sugar to it. I don't really get that. So berries are a great way to add more antioxidants, which are going to support our cells to get rid of those free radicals like Dr. Sidhartha was talking about, or that cell damage. So they essentially are helping to clean our cells and support them. So I did provide in your packet some various recipes, and in the smoothie you had today, incorporated berries. You know, adding it to your oatmeal, making a smoothie, adding it to dessert at the end of the night if we're having it. This is a great way to make sure we're still getting antioxidants. In addition to that, there are a variety of roots and herbs that we can add. So turmeric. Turmeric is kind of like the new avocado in the nutrition world. Everyone's into it. Turmeric is a root. If anyone, we can pass these around. I can keep them up. So it kind of looks similar to ginger. It's got more of an orangey hue. You can also get turmeric that's freshly ground. I can't say enough about trying to add this to your foods. Again, one of the recipes I gave you has a plant-based lunch or dinner option that's very high in antioxidants, and it also is utilizing lentils, so that is going to give us our protein. For a lot of people who are transitioning from eating meat to plant-based are like, well, where am I going to get my protein? Beans, lentils are a great way to also get protein. In addition to that, I'll talk a little bit more about nuts and seeds too. But turmeric, ginger is another one. So again, looks very similar to turmeric, and I'll have these up for you all to see. This is a great flavor to add, again, smoothies, to our oatmeal, tea, even if you just had some water with some lemon and fresh ginger. It's really, really great. And another one is mint. How many of you grow mint? Yeah. I love it because it kind of just grows on its own. I know it's considered a weed, but so you want to be a little mindful of that when you're putting it in your garden because it'll take over everything. But mint, again, antioxidant property. Add it into, again, those smoothies, anything you can. Drink it in water. Again, we want that to support our cells. So another thing, and we're coming into season again, are our dark leafy greens. This here is Swiss chard. It's beautiful. You can add this. And then another one, how many people here don't like kale? It's fine, you can be honest. Don't like kale. Why? Because it's super fibrous and doesn't really have the best taste? Right, okay. Have you ever heard of, and again, I'll have this out, baby kale? Yeah? Okay, so baby kale, again, are dark leafy greens. So brightly colored vegetables, dark leafy greens. We want to incorporate those. Those have those really high levels of antioxidants. pretty much can promise you that if you try baby kale, you will be pleasantly surprised. It's not as kind of tough as some of the other kales, and again, it still has those great nutrient-dense properties we're looking for. You can get it in any supermarket. I add it to salads, I add it to smoothies, I saute it, and it's got a really nice flavor that's not kind of too overwhelming. So that is another option. There's so many options. And then one other thing that I'll go into first would be our nuts and our seeds. Walnuts and pecans specifically tend to be higher in antioxidant properties. They're also a good source of protein, and they're higher in those healthy fats that Dr. Sidhartha was saying. We want more of the unsaturated fats in our foods than saturated. So this would be a good alternative to something like chicken or eggs that might be higher in causing the age that Dr. Sid was talking about. But they're also going to give you antioxidant support, protein, and then those healthy fats. And then another one I wanted to talk about was flaxseed. Does anyone use flaxseed here? Great. Do you grind your flaxseed or get it in a meal form? You grind it. Okay, good. So that's one thing to remember is with flaxseed, most of us aren't able to actually break it down, break the seed apart in our mouth. So it's important to get it ground so that when we eat it, it's actually getting absorbed in our small intestine and then going to our cells. One thing I will mention about flaxseed, again, it's very high in fiber, protein, and it's, again, got those great antioxidants. If you are taking a blood thinner, I would talk to your doctor before you start putting flaxseed on everything, because it can also work as a blood thinner, and we don't want to be doing too much of that. So just to be aware, although it has these great healthy properties, if you're taking certain medication, we don't want to mess with that at all. And then finally, cruciferous vegetables. So cauliflower, broccoli, these are all cruciferous vegetables. Bok choy, these have, again, the research has shown that they're very high in antioxidants. And one thing to remember, that eating healthy can taste really good, and it doesn't have to be that complicated. Maybe you don't want to get a NutriBullet and make a smoothie. That's fine. Get these cruciferous vegetables, and as you can see, this is already washed. I'm going to just prep it. There's also cauliflower has become very popular as an alternative to rice. Has anyone tried that before? What do you guys think? It's good, yeah. So it's very easy and pretty inexpensive. So again, in the recipe I gave you, instead of, typically dal is served over rice. So instead of doing that, we can just do cauliflower rice, which you basically just grate the rice and then saute it in a pan. Or what I like to do, it's just very quick. Again, I gave you the recipe. Let's take our cauliflower, break up the florets. If you don't have enough time, you can already get them in the grocery store chopped up. We add olive oil, so again, lower in saturated fat, higher in those unsaturated fats. Take a little bit, coat it, put some salt and pepper if you'd like, any fresh herbs, again. And then we're going to put it in our oven, 400 degrees, for 25 minutes, and voila. Just like Rachel Ray. We have very delicious cauliflower. Now, I know we're thinking, wait, is that charred or is that burnt? It's not to the extent if we're grilling our food. So that's something else to keep in mind. It is going to be slightly browned. So don't, overthink it too much. Again, this is super quick. You saw how fast I was able to make that. really easy to do tonight, and then adding all of those other great antioxidants in there are going to help reduce inflammation in the body and then clean our cells and keep us healthy and support a healthy immune system, which as we age is more important than ever. So that's about it, and we'll take some questions.
Before we close, we'll take some questions. Yeah.
About the slide on the chicken.
Yes.
Really something different.
So the question was, can you go over the slide that described something about the chicken? So that's called arachidonic acid. This is looking at the top food sources for arachidonic acid in a standard American diet. So what in the national survey, the National Cancer Institute, what they do is they look for risk factors for cancer in the community. They look for how many people are smoking in the country. So they look at the rate of smokers for risk for cancer. The same way they look at different risk factors that leads to inflammation, which leads to cancer. So when they assess risk factors for inflammation, they're looking at how much is the arachidonic acid load that's happening in the standard American diet plate. So when they look at different foods, they look at which food is contributing the most to this arachidonic acid in our plates. And they rank these foods by giving them different rankings as to which food is contributing the most to the amount of arachidonic acid on the plate. And chicken comes out as number 1. Is that clear? Yeah.
Yeah, I just had a question about nightshade vegetables.
Yeah.
Those are supposed to be cause inflammation, right?
So the question was on nightshade vegetables, which are bell peppers and potatoes and tomatoes, and the question was, is it true that they cause inflammation? From what I have seen, anything I say here is based on the available scientific literature, scientific research that has been done. Based on that, I don't have any evidence to support that. I do know that in certain individuals, they have a sensitivity to nightshades and they cannot tolerate it. They may have a reaction like an eczema or a skin rash, but there is no strong data to support that it causes inflammation.
Would anything cooked on a grill be considered charred?
So I always recommend if the food is browned on a pan, it's okay. But once it turns black, no matter how it is cooked, I recommend removing those pieces, because when we eat that, the blood level of the age goes up. So if something blackens in the food, no matter how you prepare that food, I recommend slicing it off, removing it. If it is browned like this, it's okay, it's good. Blackened, charred, that's the fastest way to age. If somebody comes and asks me, Doc, how can I age really, really fast? Then I say, eat charred foods every day. You have a question.
Why aren't all of us women on estrogen?
I'm sorry?
Why hasn't our doctors put us all on estrogen?
The question was, why is not everybody on estrogen? And that's because as long as it is naturally available at the natural setting, it is safe. Once we start, giving it in different dosings, we do know that there are risks that come with that. So that's why that goes for any nutrient, right? Whether it's vitamin A, vitamin E. We looked at populations that have the best vision, right? And they found populations that are eating more, vitamin A foods like sweet potatoes and carrots have the best vision, and they have less lung cancer these populations because vitamin A is an antioxidant. And then they started making pills out of vitamin A, like the estrogen concept you're talking. And then they started giving these pills to these populations and do a research study to look at whether it decreases lung cancer rate. And what it did, it increased lung cancer risk in those populations that got vitamin A. Same thing with vitamin E. So I think once we take a naturally existing molecule, whether it is estrogen, whether it is vitamin A, we take it out of the context of the whole food picture, or whole body picture, and make a pill out of it and prescribe it in different doses and strengths, it more often leads to more harm than good.
Yes, on your chart on the arachidonic acid, are you implying that chicken is not a good thing to eat because it's number one, or is that worse than beef and pork and other meats, or red meats, which we've been told not to eat, or is it because we eat a lot of chicken that it's number one?
So that's a good question. So the question is, the answer is, yes, chicken is bad for health. That's the answer. What that ranking says is that number one is chicken, number two is eggs, number three is beef in that ranking. If you went to a 1960s data in the same ranking, beef would have been on number one, and then chicken was probably number 2 or 3. So now we are switched from red meat to white meat. So what's now happened is that the most contribution that's coming to our plate is coming from chicken in now, because more of us are eating chicken instead of beef. But when it comes to whether beef or chicken that gives arachidonic acid, both of them are doing it. It's a question of which one we are doing more of. And if you choose lentils in that recipe that you have, for protein instead of chicken or beef, we're not getting any arachidonic acid. So it's a question of what kind of protein choices we make to make up for a whole meal, and whether that protein choice, whether it is bringing more health or more harm to us. Does that answer the question? Yeah. Is that? So the question is speaking about seafood, and we are on Cape Cod. We are in a place where the economy depends on seafood, and I do have to say that in the arachidonic acid listing, the seafood comes in the top 10, but it's around 6 or 7. And in general, I think moving from red meat to and white meat, in my literature science and what I have seen in my science and my patients and research, I consider the harm of red meat and white meat the same. In my world, that they are the same. So moving from red meat to white meat to protein choices that incorporates more of the beans, lentils is a better way to start including more protein, and supplementing it with a small dose of seafood now and then is okay, as long as we are not in an advanced disease stage. It really depends upon how much excellence in health you want. If you want the A+ health, then the effort towards that needs to include moving more towards a plant protein choices, plant-based foods. So it's called a dose response curve in scientific lingo. The more dose we increase it, the better response it is. So, and I think we'll take 2 questions and we'll close. Yeah, this person.
What is your opinion to Dr. Dianna's approach, eat right for your blood type, and in particular applied to arthritis?
So the question was on the diet modality that's out there about eat right for your blood type. So when we look at the scientific basis for it, it doesn't hold up. So I do not recommend that based on the available science.
Right here. Mine's two-pronged. One, soy-based. There's controversy about that. And then, I don't know if it's the 15 dirty and the 12 clean. Do you want to speak about organic versus non-organic plant?
Yeah, what was the question about the soy?
Soy, like, I do eat, but in moderation, because as I keep reading, I don't know if it's good to eat soy and fermented, that other very, very strong tasting thing you can make with tofu and make a beautiful stew with root vegetables. But I don't know if that's a good regular thing. I eat a lot of beans. I'm mostly plants and vegetables.
Yeah. So what was the second question again?
One was about soy products, including TVP.
Yeah.
Protein,
The dirty
and the other
doesn't
one is
And the dirty
about,
doesn't, yeah.
is
We'll
it
talk
wor-
about that.
Is it
So-
important to do organic
Sure.
versus non-organic?
So when it comes to soy products, I get this a lot. I get these questions a lot, and Dianna, you can also chime in a little bit there. This is what I have found. Number one, if you need to switch to a complete plant-based diet, you do not need to rely on soy or tofu. You can eat a complete plant-based diet, get all the protein you need with beans that grows right here in New England, right? Cow bean, turtleneck beans.
Yeah.
So yeah, there is so many protein choices that grows right in New England on the ground without having to choose animal protein and without having to choose soy protein. The second point is that there has been some unnecessary confusion out there through the media about soy and breast cancer. Now we know that organic, unprocessed, wholesome soy products is one of the ways to prevent breast cancer. The World Cancer Research Fund recently, every 10 years, they will put out findings about risk factors and protective factors for cancers in the world. And for breast cancer, their latest recommendation includes, if soy is part of your cultural tradition to eat soy, to make sure you eat a regularly unprocessed soy is a recommendation to prevent breast cancer. The Shanghai Women's Health Study that looked at more than 2,000 cancer survivors who had women's breast cancer. This was looking at women with history of breast cancer. They were following them up for 8 years to look at who is getting breast cancer again and who's not getting a recurrence. And they followed their diet pattern, and they specifically zoned in on different diets and looking at which diet was protective and which was leading to recurrence. And they found that those women who ate the most soy per week in terms of servings compared to the least soy servings, the ones who ate more soy products had less recurrence of breast cancer. And there is just more studies that looked at, and I think that controversy is a done deal. There is no more controversy about breast cancer and soy, as long as it is organic. But the larger point to remember is, in order to switch to a plant-based diet, you don't need to rely on soy or tofu. If you like it, go for it. I recommend organic. I make sure it is wholesome, not like a processed food. And the wholesome soy products are 5 soy products that are wholesome, which is the soy milk, the edamame beans, which is what it's made out of, and the soy nuts, tofu, and tempeh. Tempeh is a fermented tofu. It's like you have cabbage and then you have sauerkraut, which is fermented cabbage. The same way you have tofu and tempeh, which is a fermented tofu is tempeh. So those are the 5 wholesome soy products. Organic is always better. You don't need soy to switch to a plant-based diet. Do you have anything to say about it?
Yeah, no, and that's a great question because I do work in the cancer center at Cape Cod Hospital, so I see a lot of women who are concerned because they have breast cancer and they're like, I can't eat soy. And like the research you were talking about, and Dana-Farber does a lot of research with this in Boston. They have a great video on there explaining their research, so you can go to their website and access it. But that's what the research has been saying, that if it's whole, organic soy products, like the 5 Dr. Sidhartha listed, then you're fine. The thing is now, everyone wants protein, right? It's kind of a big topic in nutrition. So a lot of companies are taking soy protein isolate and certain components of soy and processing it and putting it into things like cereal, granola bars, the fake soy, like chicken nuggets and those sorts of things. So that's where it's not as healthy for our body in that case.
And the only other thing you want to watch out for, if somebody is you like soy, you like tofu, you like edamame beans, you eat a lot of it, if you have thyroid conditions or goiter, or thyroid conditions, that's not recommended to eat too much soy. So that's the only area you need to watch out for. And I think we will.
The dirty
The
dozen.
second question was on organic foods, and there is this list that is out there in the you can Google search it. It's called Dirty Dozen. So it's looking at the most pesticide laden foods that are in the store shelves. The 12 most pesticide laden foods that are called the Dirty Dozen. And so if somebody wants to choose organic foods, and if they cannot afford to buy every single food as organic, then the concept here is that at least these 12 foods, buy them organic, because they have been known to have the most pesticides. So you can find that list. It's put out by a group called Environmental Working Group. They do this survey. They go to the stores and they do surveys and sampling of these foods to find out which foods end up having the most chemicals and pesticides. And they create a list every 2 years, I think. So it's called the Dirty Dozen. And then they also have a list called the Clean 15, which is the 15 foods which has the least pesticides. So those foods you need not buy organic. You can buy conventional. So the Clean 15 and the Dirty Dozen is out there.
And
So
strawberries are on the dirty dozen.
correct, yeah. The berries are on the dozen, so you would watch out for that. So I think we're going to close with that. I want to thank you all for showing up. Our next event. Thank you. So our next event is coming up, and we will also send a survey after this event so that you can give us feedback on how we can do this better. The next event is back in Hyannis. Remember that. It's in the Resort Conference Center. June 10th, we're going to focus on mental health, because we realize how mind and body both are important for the whole health. So we're including the piece on mental health next time. And I want to thank the speakers, fabulous speaker lineup today, Dr. Wilsterman, Dr. Paul Hull, Catherine, and Dianna for being here. Thank you.